Thank you very much, Ms. Shaw, for joining us on Mirror Now. It is indeed a great day and a great start to the new year now that we've finally seen this vaccine drive really kicking off. Of course, this is the first phase, the first day. The first set of people have started getting vaccinated. And we've seen some of the top doctors, including AIMS director, including VK Paul, who've gone ahead and, got the vaccine, obviously in an effort to also set an example to others. But the dry runs we've conducted, how do you see this, panning out now in terms of India's preparedness?
Well, I think, the Ministry of Health has really worked very hard to have a very high level of preparedness. I think we just heard the Honorable Health Minister explaining everything that the software is capable of doing, and I think that's extremely commendable. And I'm sure that this first phase will be deployed very well. And I'm sure we will get a lot of data coming out of this first phase. So I'm very hopeful that, the first priority strata will actually receive their vaccinations in the way that was described, with these messages, with, even alerts for their second dose, etc., etc. So I think it's a very, very well thought out software program.
Yes, and of course, there have been a lot of, talks in terms of people also questioning the vaccines at this point in time. And especially with respect to co-vaccine, there is a separate, form, also a consent form that needs to be filled out as well. What would you like to say to all of those people who have been raising questions about the vaccines?
Look, today I think the world is in a state of emergency. You've heard how the US is really, really challenged with vaccination. We are fortunate that we have 2 vaccines approved under the EUA label. And we are very fortunate that we also have the supplies which are not constrained. And I think from that point of view, I think we should really be very thankful that we have the kind of capabilities and the vaccines available for deployment. Now, I don't think we should get into any kind of controversy at this stage, because I think every regulator in the world is really assessing the risk and the harm caused by the virus. And I think from that point of view, we must, be very focused on vaccine deployment. And I think both these vaccines will actually serve us well.
Yes, and Ms. Shaw, the other thing, the Prime Minister also spoke about it a while back while inaugurating the drive itself, and that is that even those who take the vaccine, who are administered the vaccine, should not let their guards down and continue to follow the COVID norms. And this is something that needs to be emphasized properly, not just for those who've taken the vaccine, but even obviously for those who've not taken the vaccine.
Absolutely. I think this is not a time to let our guard down. Of course, we are seeing numbers coming down, and that's a very reassuring sign in the country, because we are seeing that the vaccine, infection rates are coming down, mortality rates are at an all-time low. So all these are very, very promising signs. But nevertheless, we should not let our guard down, because we know what happens when you let your guard down. Many countries have had a surge in the pandemic, and a very nasty surge at that. And we also know that there are many mutant strains floating around. So I think we must focus on getting vaccinated as soon as possible. And I think we know that we have a plan of action in terms of vaccine deployment, in terms of phase 1, phase 2, phase 3. And I, for one, believe that we should really focus on maximum deployment of vaccines.
Yes. And also, Ms. Shaw, going forward, of course, the first phase is going to see all the frontline healthcare workers get vaccinated, and then it will slowly open up. But going forward, what, according to you, could be big challenges? Of course, as a country in India, we have done mass vaccination programs before, but this is, something different, because this is a 2-dose vaccine here. There's a different level of data management that needs to be done. What do you think the challenges could be going forward?
I think the health ministry has thought of all these challenges, and that's why they're trying to make it linked with a good software program that can actually, plug a lot of these deficits. And I just hope that all this works seamlessly, because you know that There will be problems, there will be glitches, but we should be able to fix it fast. That's the whole challenge that we have. Because you know that in even a country like the US, they are really struggling with coping with the kind of scale of vaccinations that they want to aim for. So I think we also should try and track the number of vaccines we are able to deploy every day. And I think we should keep looking at what the the little glitches are, what the challenges are, and keep trying to fix it as we go along. I, for one, believe that after this, the phase one, where you are basically deploying it for the frontline health workers, we should quickly move into phase two and phase three, because I would like to see the workforces in our country being vaccinated so that our economy can come back to normalcy. I also want to get students back into colleges and schools. And so all this needs to be done very thoughtfully and fast.
Yes, yes, absolutely. Misha, the other question that I wanted your thoughts on was with regard to this issue over indemnity from vaccine makers, because, this was requested by the vaccine makers, both Bharat Biotech and Serum Institute some time back. The government said no at this point in time, and Serum Institute has also responded to that as well. But what is your own view and stand on this topic?
So first and foremost, I think we do need indemnification of the vaccine per se. If there's any quality related issue, then obviously that cannot be indemnified. But I think anything pertaining to the vaccine at this point in time needs to be indemnified, because we just world over don't have adequate data. So we are taking a risk benefit kind of judgment call. And it's not fair to put the entire burden on vaccine makers, because you've seen that, even the mRNA vaccines are seeing serious adverse events and even deaths in many parts of the world. Now, because you've developed these vaccines at warp speed because of this pandemic and this emergency health situation, you're sort of balancing the risk and the benefit and giving these emergency use authorizations. So I believe that to that extent, I think that by the vaccine companies, and after all, we can only not indemnify them if the vaccine is found wanting in terms of quality, or if there is any serious, fault of the vaccine because of the manufacturing aspect.
So you do believe that this is something that perhaps calls for a relook at this point in time, something that the government should relook and perhaps be discussed further before a decision is taken?
Well, I would like them to reconsider it, because I think countries all across the world are indemnifying vaccine vaccine makers.
All right. And Mishra, my last question, of course, we've carried out the dry runs. Multiple dry runs have been carried out, and now we are in the first day one of the vaccine drive at this point in time. What would be your message to people who are going out and getting the vaccine right now, the first frontline healthcare workers, and then obviously everybody else who's going to be next?
Well, I just want everyone that is eligible for a vaccination to get vaccinated, because we really need to vaccinate our country very fast and very rapidly and very at scale. So I think we need to focus on speed and scale of vaccination, because we are a very large country, and we are a very diverse country. We have we have regions which are very difficult to reach. So I think we need to make sure that we do this vaccine deployment with the cooperation of people.
All right, Kiran Mazumdar Shaw, thank you so much for joining us and speaking to Mirror Now.